Infectious diseases are illnesses caused by harmful agents, pathogens, that get into your body. The most common causes are viruses, bacteria, fungi, and parasites. Infectious diseases usually spread from person to person, through contaminated food or water and through bug bites. Some infectious diseases are minor. Type of infectious disease. Infectious diseases can be viral, bacterial, parasitic, or fungal infections. Common cold. The common cold is an infection of your nose, sinuses, throat, and windpipe. Colds spread easily, especially within homes, classrooms, and workplaces. More than 200 different viruses can cause colds. There's no cure for a common cold, but it usually goes away within a week to 10 days. The flu, influenza. The flu is a common respiratory illness you get from the influenza virus. Symptoms often include fever, head and body aches, coughing and a stuffy or runny nose. You're at risk for serious complications if you have an underlying health condition or are pregnant. Getting vaccinated every year is the best way to avoid getting sick with the flu. COVID-19. COVID-19 is caused by the SARS-CoV-2 virus. COVID-19 can cause mild to severe respiratory illness, including death. The best preventive measures include getting vaccinated, wearing a mask during times of high transmission, staying 6 feet apart, washing hands often and avoiding sick people. Stomach flu, gastroenteritis. Stomach flu, viral gastroenteritis, is a viral infection in your digestive system. It causes gastrointestinal symptoms like vomiting and diarrhea. It's usually brief, but can be very contagious. Hepatitis. Several viruses are known to cause hepatitis, which refers to inflammation of the liver. You may lower the risk of getting hepatitis by avoiding risky behaviors, such as sharing needles, having unprotected sex and drinking large amounts of alcohol. Respiratory syncytial virus, RSV, is a seasonal, highly contagious respiratory virus that often feels like a common cold. But infants and some adults face a higher risk of severe symptoms and complications. Treatment usually involves at-home care. Some people need oxygen, fluids, or other care at a hospital to fully recover. Strep throat. Strep throat is an infection in your throat and tonsils caused by a type of bacteria called Group A Streptococcus. Strep throat causes severe inflammation and a sore throat. A healthcare provider can typically diagnose the condition with a rapid strep test or a throat culture. Treatment usually includes antibiotics. Salmonella. Salmonella, or salmonellosis, is an infection with Salmonella bacteria that causes diarrhea, fever, and stomach pains. Salmonella usually goes away on its own in a few days. You should drink plenty of fluids to prevent dehydration. You can reduce your risk of salmonella with safe food handling habits and by washing your hands after touching animals. Tuberculosis is an infectious disease that can cause infection in your lungs or other tissues. It commonly affects your lungs, but it can also affect other organs like your spine, brain, or kidneys. Whooping cough, pertussis. Whooping cough, pertussis, is a very contagious respiratory infection that causes a distinctive whooping cough. The condition can cause bouts of repeated, violent coughing that may come and go and last for weeks or months. Pertussis can cause severe, life-threatening illness, especially in babies. The pertussis vaccine can help prevent it. Sexually transmitted infection. Sexually transmitted disease is a serious condition that can develop after you have sex. Common STI symptoms include itching and burning around your genital area. The good news is that most STI treatments can cure the infection, but not all types. You can get an STI again, even after treatment to cure it. Urinary tract infections, UTIs. Urinary tract infection is a very common type of infection in your urinary system. It can involve any part of your urinary system. Bacteria, especially E. coli, are the most common cause of UTIs. Symptoms include needing to pee often, pain while peeing and pain in your side or lower back. Antibiotics can treat most UTIs. Vaginal candidiasis. An overgrowth of the fungus Candida causes a vaginal yeast infection. A vaginal yeast infection causes the skin around your vagina to burn and itch, and it may change the consistency of your vaginal discharge. Treatment includes antifungal medication. Guys, please subscribe this channel. Ringworm. Ringworm is an itchy, contagious fungal infection that causes a ring-shaped pattern on your skin. Over-the-counter and prescription treatments can stop the fungus from spreading to other parts of your body or to others. Thrush. Thrush, a fungal infection of your mouth, happens most often to toddlers and children but can affect anyone. It can result in creamy white lesions on your tongue or inner cheeks. Causes include certain medications and some health conditions, such as dry mouth or diabetes. Treatment usually involves antifungal medications.